Hello my dear students, I am back with my next video. In this video we will discuss our fifth chapter. The name of the chapter is Therapeutic Approaches. Like in the preceding chapter, we have discussed about the major psychological disorders and the distress that caused by them to the patient and to the others as well. In this chapter, we will learn about the various therapeutic methods that are used by psychotherapists to help their patients. There are various types of psychotherapists. Some of them focus on acquiring self-understanding, that what is our existence other than action-oriented. All approaches have basic issue that how they can be help the patient to overcome their conditioning that are unbearable for them also. There are so many factors on which the therapeutic effectiveness depends, like what type of disorder the client is having, what is the degree of the distress the client is facing, and what is the time availability, efforts, and money, and another all the things. Mainly therapeutic approaches are helping in nature. All of them involve interpersonal relationship that is most important between the therapist and the client, or you can say patient. Some of them are directive in nature, they are therapist centered, and some are non-directive that are known as person or client centered. In this chapter now we will discuss about some major form of the psychotherapies. Before starting this chapter, I just want to tell you one thing, that some of the disorders can be overcome by the therapist and some needs some type of medication by the psychiatrist. So in this chapter we will talk about the therapist also and some of the medical therapies that are recommended by the psychiatrist. Firstly, we should understand what is the meaning of psychotherapy. Actually, it is a voluntary relationship. Voluntary mean to say agreement of both person between the one seeking treatment, that is client, and another one who is treating the client, that person is known as a therapist. Now here question arises, what is the purpose of this relation? Actually, the purpose of the relation is to help the client so that the patient can solve the psychological problems that are being faced by him. This relationship actually based on one major component, that is trust, so that the problems can be fully discussed with the therapist. In all this process, psychotherapists are having only one major aim, that is changing the maladaptive behavior of the patient and decreasing the distress in person's life. Also help the client so that he can adapt better with his environment. All the psychotherapist approaches have some common characteristics in which they have to follow the principles for different theories of therapies. Another feature, the person who is giving the therapy, that person should be practically trained, and nobody can give this type of therapies, like we can say that untrained person may unintentionally cause more harm than any good. The interaction between these two persons, that is therapist and the client, always result in formation of a therapeutic relationship, that I already told you that it is based on one major component, that is known as a trust. The whole process, giving the therapy and everything that is going to be done in the therapy, it should be confidential. And all the psychotherapies are having their some type of aims. You can say they are having some goals like resolving the client's problem. They have major aim to lessen the emotional pressure of the client and try to unfold all the potentials so that the patient can grow himself in positive way, modify the habits that are not good according to the environment, try to change the thinking pattern of the client, increasing self-awareness and improving interpersonal relations and communication. Moreover, make the client able to take decisions and helping him in making aware of his own choices in life, helping the client in making social relationship also. So this is all about the psychotherapy. Now we will come to our next topic, that is therapeutic relationship. The special relationship between the client and the therapist is known as a therapeutic relationship, or it is also known as an alliance. This relationship is not permanent and it is not long lasting. Actually, it is based on the two components. First component is that there is a contractual nature of the relationship in which the two persons involved. That two persons are client who want the help and the therapist who want to help the client so that the client can overcome his whole problems. And the second component of therapeutic alliance is limited duration of the therapy. This alliance, or you can say this therapeutic relation, it lasts until the client become able to deal with his problems or make himself able to control his life. This relationship is mainly based on trust or confidential. It is only because of the trust of the client that he try to unburden himself to the therapist and always discuss his problem. On the other hand, therapists always encourage the client by being accepting, empathetic, genuine, and warm attitude towards the client. Therapist always has that type of behavior in which he try to be non-judgmental and always try to show positive feelings towards the client even if the client behave in a rude manner. This behavior, when the therapist tried to show his positive regard to the client, this is known as a unconditional positive regard. Therapist also has sympathy for the client. Actually, sympathy is different from the empathy. In sympathy, one person has compassion and pity towards the suffering of another, but when one is able to understand the plight of the another person, basically it means when we try to understand the things from other person's perspective and we are putting ourselves in the another person's shoe, then it is known as a empathy. Empathy is a major component that try to enrich the therapeutic relationships and it transforms it into a healing relationship so that the client can overcome his all type of problems. In this, one thing is more important on the part of the therapist, that therapist must not exploit the trust and confidence of the client in any way. Finally, it is a professional relationship and it must remain like that only. Now we are having some type of therapies for different type of psychological disorders. Before that, you can say that in this topic that we have done therapeutic relationship or alliance in this mind map. In this we have to cover two major topics, that is unconditional positive regard and the concept of empathy. Now there are so many types of therapies. All the psychotherapists aimed at removing human distress and fostering effective behavior. We can classify psychotherapists in three broader groups, that is psychodynamic, like you can see in this mind map, psychodynamic, behavioral cognitive therapy, and existential therapy. These are the main therapies. After that, we are also having another therapies. If we talk about a chronological order, actually psychodynamic therapy came first and it is followed by behavior therapy. At the last, existential therapy emerged. The classification of psychotherapist is based on some parameters, that what are the causes that lead to the problem and how this cause come into the existence. If we are able to diagnose the problem, then what type of treatment we can give to that problem, what type of therapeutic relationship should be there between the client and the therapist. If the client is taking the therapies from the therapist, then what is the chief benefit to the client? And the last parameter is what should the duration of the treatment. So in this way, in all the therapies we are having 6 parameters. So now we will discuss about our first parameter, that what is the cause which has led to the problem. In each parameter, we will discuss about the 3 psychotherapists. So, in psychodynamic therapy, the cause of the problem is intra-psychic conflict. Mean to say, there is a conflict that is present within the psyche of the person. Next therapy, that is behavior therapy. In this, psychological problem occur only due to the faulty learning of the behavior, as its name suggests that it is related with the behavior. It is also known as a cognitive therapy, that is related with our thinking process. And in the next, that is our last therapy, existential therapy. In this, the person is having the problem related to his existence. When person question himself that what is the meaning of my life. Next parameter is that how these causes come in their existence and what is the background of the problem. In the psychodynamic therapy, as we know that it occurs only because of intrapsychic conflict, there are some type of unfulfilled desires of the childhood and some type of childhood fears that lead to intrapsychic conflict. For example, if the child wants something in his childhood or he is not able to get because of his economic condition due to demise of his parents or some type of traumatic conditions faced by child. So all these things can create fear in the client or the client is not able to overcome. In his childhood, maybe the person didn't get a positive environment. So these problems could lead to intrapsychic conflict. Our next is the behavior therapy. Like in this also we have discussed that it occurs due to faulty learning of behavior. It may be due to faulty learning, faulty thinking and faulty conditioning patterns. For example, if the person has seen someone to whom the person considering his role model, if that person is behaving in inappropriate manner and person also following the same behavior, that is inappropriate. Our next therapy, existential therapy. In this person always feel loneliness. He always questioned himself about his existence, as I already told you. Our next parameter is how we can overcome this type of problems. In psychodynamic therapy, we use the method of free association. We will discuss this method in detail when we will read psychodynamic therapy. In behavior therapy, the therapist try to identify that what type of behavior, conditioning patterns and what type of alternative behavior can suggest to the person to improve his behavior. In the same way, in the existential therapy, we try to provide positive, accepting and non-judgmental environment to the client and the client can talk about all his problems and the therapist act as a facilitator. Our next parameter is what is the nature of the therapeutic relationship between the client and the therapist. In psychodynamic therapy, the therapist try to understand the intrapsychic conflict within the client. He tried to understand the thoughts and the feelings of the client by free association method. In behavior therapy, the therapist assumes that he is capable of finding out the correct behavior and thought pattern which would be easily adaptive for the client. In the case of both psychodynamic and behavior therapy, therapist shows positive behavior towards the client problem that definitely he will arrive at a solution. In contrast to these therapies, in existential therapy, therapist shows empathetic relationship in which client himself feels secure to understand the nature and causes of his problem that he is facing and he will understand his existence in his life and in another person's life also. Now our next parameter, what is the chief benefit to the client of getting these therapies? In psychodynamic therapy, client is able to get emotional insight, means he becomes aware about his emotions and accept the emotions, as well as he is able to modify his emotions towards the conflict. Because of emotional insight, client distress also reduce. In the behavior therapy, client is able to adapt himself with the situations and his thought process reduce the distress. The humanistic therapy, that is also known as existential therapy, provide chief benefit to the client in his personal growth, in which he is able to understand of his emotions, strengths, weakness, etc. Now our last parameter is that what is the duration of the treatment? The duration of classical psychoanalysis may be continued for several years. However, some of the sessions of psychodynamic therapies can be completed in 10 to 15 sessions. On the other hand, behavior or cognitive as well as existential therapies are shorter and can be completed in a few months. After this, we can conclude that different types of psychotherapies has different multiple parameters. However, they all share the common methods of providing treatment for psychological distress through psychological means. In all these, the therapeutic relationships and the process of therapy are main agents of change. Due to these agents, client able to overcome the problem. So thank you very much. In this video, we have discussed about therapeutic relationship and nature and process of psychotherapy. In our next video, we will continue with our next topic, that is psychodynamic therapy. Now we will do all the therapies in detail. Thank you so much. Have a good day.